Welcome to 6ABC's Local Spotlight. The following advertisement is paid for by Mainline Health. Here's Jessica Boyington.
Through their affiliation with Children's Hospital of Philadelphia, Mainline Health brings world-class care close to home. Families have access to CHOP clinicians in the neonatal intensive care units and in Bryn Mawr Hospital's emergency department and pediatric unit, providing convenient, compassionate pediatric care close to home. We're here today with Dr. Annamarie Koller, a pediatric hospitalist at Mainline Health and Children's Hospital of Philadelphia. She's going to talk to us about the expert pediatric care available to our community, common conditions they see and treat, and preventative measures you can take to keep your children safe and healthy this summer. Dr. Koller, welcome.
Thank you so much for having me. I'm very excited to be here.
Oh, great. We're so excited to have you. So tell us a little bit more about the benefits of the affiliation between Mainline Health and the Children's Hospital of Philadelphia.
With this partnership, we can offer high-quality pediatric care close to home. If your child needs extra care or prolonged treatment, we can admit them to our pediatric unit in the hospital. This unit is designed specifically with children in mind, staffed by highly trained, seasoned, and extremely kind pediatric nurses. Families with young infants and newborns will also benefit from the CHOP and Mainline Health partnership. There are neonatal intensive care units, or NICUs, available at all 4 Mainline Health campuses.
Why do you think it's important for Mainline Health to offer these specialized pediatric services to the community?
So pediatricians and pediatric emergency medicine doctors are trained to quickly diagnose and treat children who are acutely ill or injured. It is helpful to have a pediatrician present when treating children, as we are specialists in their care. We know how to support the child and the entire family during their visit to the hospital. With our Mainline Health and CHOP affiliation, we're able to utilize CHOP's expansive resources and practice the best evidence-based, high-quality care right in our own neighborhood.
A lot of parents worry, and rightfully so. When is an emergency department visit actually appropriate for kids?
So, although I'm a pediatrician and an expert in care for children, parents and caregivers are experts on their own kids. Try to identify if your child's safe and stable first. If they're still running around the house and complaining of a little earache or a small insect bite, you probably have time to call your pediatrician for guidance first. If your child's showing more severe symptoms, they may need care right away. For instance, if they have an head injury or head trauma, and it's associated with altered mental status or a loss of consciousness, or they have persistent vomiting or severe headache, they may need care immediately. Another rule that I often share with parents is that if the belly pain keeps your child from standing straight up and down, or they can't walk up and down stairs, this may signal more than just a stomach ache.
All right, well, summer is upon us. It's the longer days. The kids are outside. They're very excited that it's on its way. So that just means probably more playtimes, more illnesses, more injuries. What are some of those common injuries and illnesses that you see and that parents should watch for at this time of year?
We know sometimes their curiosity can lead to more injuries, so we'll see an increase in more minor traumas, bumps, bruises, and even broken bones. We also see sports-related injuries to the heat. So that's from extra sun exposure or even overuse injuries, especially in those adolescent patients who may be doing some extra training for a specific sport.
All right, so give us the tips for keeping everybody, I guess the kids and the families, healthy this summer.
So sun protection, make sure your child's wearing sunscreen, choose an SPF 30 or above, reapply often. Think of water safety. Always supervise children when they are swimming or playing around water. Insect protection, so make sure you protect them from insect bites using a repellent. And one last thing is travel safety. So continue to use those properly fitting car seats, booster seats. Never leave kids alone in the car. And then when traveling to a new area, consider checking to make sure that you have the safety measures in place that you already have at home.
All right, so whether you're a parent, a caregiver, or you obviously know somebody with some children, Dr. Koller, thank you so much for being here. This was great information.
Thank you so much for having me. It was a pleasure.
All right, well, to learn more, you can visit mainlinehealth.org/wellaheadphilly. Thanks so much for watching and have a great rest of your week.
Thanks for watching 6ABC's Local Spotlight. The preceding advertisement was paid for by Mainline Health.